Remains the #1 killer here in America, but patients are also doing better than ever before if heart problems are caught early. In today's Well-Being Report, brought to you by Hartford Healthcare, Sarah Cody takes us to the cardiac unit at Backus Hospital, where doctors are urging folks to be proactive.
Well-Being, sponsored by Hartford Healthcare.
There are 3 major arteries in the heart, and we can film them from multiple locations.
At Backus Hospital in Norwich, technology in the cath lab is key in detecting problems. Then action in the rehab program helps patients battle heart disease, the #1 killer in America.
After a heart attack, when we start people very slow and then progress their activity level, this is the place we do it.
A visit here is an example of secondary prevention, taking steps to reduce more issues in the future.
It gives them the confidence and the families the confidence that, you know what, after a heart attack, there's life.
But Medical Director of Cardiology John Foley says experts are going into the community, urging people to practice primary prevention, making smart choices from the get-go.
Things like cholesterol screening, blood pressure screening, work in the schools, in the senior centers. People, health systems, the government, everyone realizes that it's a lot easier to prevent disease than treat it. It's also a lot less costly.
The vital advice: exercise, don't smoke, and eat right.
It can be very helpful to cook at home. So when you're making the meal yourself, you know exactly what's going in.
Registered dietitian Lauren Nichols relies on portion guidelines from ChooseMyPlate.gov.
A portion for protein should be about the size of the palm of your hand. It's about 3 or 4 ounces usually.
A quarter of the dish should contain whole grains like pasta.
I actually recommend making half of your plate, if you can, the non-starchy vegetables. It's a good way, again, to get a lot of extra fiber, extra nutrients.
It's all about investing in the health of the population, a mission that will pay off in years to come.
Our focus really is on the community, and I like to think that we try to prevent citizens from becoming patients.
The Backus Hospital Rehabilitation Program is also used by patients with pulmonary disease.